my name is Alexa. My student ID is 3388636, and this is my second video for nursing. So we'll go over ECGs, eye staining, Schumer tear test, eye pressures. We'll do all of our dental procedures, so dental x-rays, hand scaling, ultrasonic scaling, prophy paste, polishing, and yeah, it's gonna be great. Do an ECG on Zoba here. So you want your dogs in right lateral. The way you minimize artifacts is making sure they're on a non-conductive surface. So we're on our rubber mat on our treatment table. You want to make sure your leads don't touch, that when they're under anesthesia, that they're nice and warm, that they're not scared, they're not trembling. That can cause artifact, or if your leads are touching, that can also cause artifact. So let's get you hooked up. Go there. Towards me. 1, 2, 3. Good girl, baby. Get your ear out of your face. Okay, so we have a lead. We have a 3 lead. Okay, so our black is the left. So we'll go. Our black one likes to be below the joint. It's happier that way, but typically you go above her elbow joint. And then, Zoe, you're okay, baby.
Stay.
And then the red one goes, sisterly, on the left rear. So think of it as smoke over fire. And then last but not least, our white one is right axillary. So we'll go there at the bottom, quote unquote. And then you just want to make sure they're wet with alcohol. You're okay though, good girl. So they can conduct. And then when you do an ECG, like if you're in surgery, you want to make sure that you have all the correct waves. So you want to make sure you have a P wave, a QRS complex, and then a T wave. If you're sending out to the cardiologist, you let the paper run for about a minute to like a minute and a half. You're okay, Zoe. Hands up. Good girl. Good girl. So. This is kind of backwards, but like I said, you want to see the P, and then we have our QRS, and then we have the T right after. So we have,
Stay.
She's moving a little bit. Good girl, Zoe. So P, QRS, T. And with an ECG, if you're missing one of those complexes, you want to tell your doctor right away. Everything with the ECG not only should have those complexes, but it should be evenly spaced apart. If they're not evenly spaced apart, if one of those complexes is missing, or let's say like the first P complex doesn't look like the third P complex, then you want to alert your DVM. We are going to do an eye staining on Miss Zoe here. So the reason you do eye staining is it looks for issues with the eye. So either an ulcer in the eye, a scratch on the eye, anything like that. So the way you do that is you use this staining strip. So how we do that is we're going to take the plunger off of our syringe, take our eye wash. We're just going to put that in here. Open this up. And then we're just going to dip our stain in here. Just like that. Okay. And then sometimes eye boogers can stain too. So if you think it might be debris or like an eye booger, you just let them. Well, that didn't work. You just let them blink a few times, and then Usually if it is debris or an eye burger, it'll go away. So you just pull the eye, open the eye, and then you just drop a little bit of this in here, rinse out their eye, and then you look with the ophthalmoscope on the blue light to see if there's any reactivity to it. All right, Zilbear, you ready, girlfriend? All right, I'll come over here. So open the eye. I know, sis. A little more. I know, good girl. A few drops. Let that sit for a second. Just get a little piece of gauze and we'll rinse out with the eye. I know, Zoe. I'm sorry, baby. Good job.
Good girl.
Good girl, Zoe. Okay, so then we have our blue light. And you just want to look from top, bottom, side to side and make sure there's no, you're okay, Zoe. Good girl. And make sure there's no reactivity. Open, open. Good girl. Okay. And Zoe is not reactive anywhere, so she does not have any ulcers and does not have any scratches on her eye. This is my streamer tear test. Basically what this test does is looks at tear production in the eyes. So you have this little strip, it's in millimeters. What you do is you fold the very, very end over so it makes like a little lip. And that lip goes into the bottom eyelid and you gently just hold the eye shut and you hold it there for a whole minute and see how many millimeters the tear production comes up to. Anything 10 and under is you have a problem with tear production. 10 to 15 is you might have a problem, you might not. And then over 20 is good tear production. So 20 is what we're shooting for. Some veterinarians on healthy dogs that have good tear production, once they get to 20, they'll remove it from the eye and say they got to 20 millimeters in 15 seconds, 20 seconds, whatever it was when they got there. So we'll open this up. And you don't want to touch where it's going in the eye. So you can just fold it over in the package. Just like that. Okay, so we'll fold it over. All right, so pull that bottom lid down and just, I know, baby, gently hold the eye shut for a minute. Hold the eye closed too tight, because that can skew your results. Okay, so you want to gently take it out of their eye. And Zoe is at right about 18 or 19, so she's close. And that is how you do a shimmer tear test.
Good job.
Okay, so this is Lily. We are going to do eye pressures on her today. So with eye pressures, Lily gets them done every couple months. She's a very good girl for them. As you can see, she had an enucleation of her right eye. Kind of, you can't see it in her gray. But so we like to keep an eye on the left eye to make sure her pressures are okay. So with restraining for eye pressures, you hold them right under their jaw, like you hold for a jugular jaw, except you're not picking the head up all the way and you're not holding pressure super, super tight. Because if you hold their head tight, then you can increase eye pressures and get a false reading. So with Lily, we have already numbed her eye with piperacane, so she is good to go with our tonneau pen. All right, Lil, you ready, sis? our tonneau pen has been super temperamental lately. So sometimes we'll get 2 readings and then it'll tell us to calibrate. So. So that one is 20. Good job, Will. That one's 16. And last but not least, all right, and that one was 20. So I will let the doctor know. And we will, the doctor will change meds if necessary. So with the tonneau pen, when you're doing eye pressures, you want to hold it as flat as you can when you do them. That seems to work better and you tend to get a little better readings that way. Okay, so this is my example, how to do an enema. So this is my dog Aria. She actually doesn't need an enema, but we're still going to be going through all the steps because nobody came in for an enema. Before the video was due. So what I have is I have my big syringe with not a lower lock tip. It has this kind of tip, so it attaches to the rubber catheter. We have a red rubber catheter. I'm not going to take it out of the package for this because it's sterile. And then I have my body temperature water with a little bit of soap in it. And then my lube. So what would happen for an enema? We would obviously take this out of the package, and then we would draw up our water, our enema solution that we made, into the syringe. Kind of set that aside for a second. And then to actually do the enema, what size of red rubber catheter you use and how far you insert it depends on the size of the dog. So we would take this out of the package, we would use a little bit of lube, and just kind of put it on a sterile 4x4, and then we would just put the tip into the lube, and then we would gently insert the catheter into the rectum. You don't want to push too hard with the red rubber catheter, or when you actually do the enema with the water solution, because you could actually tear the rectum. So you just gently insert it up a little bit until you think it's a good spot. You don't want to go too far, but you don't want to be too far back either. And then when you get it to the right spot you want, you just attach your syringe to the back of the red rubber catheter, and then, like I said, you just gently push the water solution in because you could tear the rectum if you push it too hard. And then after you do however many cc's the doctor wants, then you just gently take the red rubber catheter out. And then you might want to kind of stand to the side because some liquid and or poop can come out. Typically this is done on a wet table in case stuff does come out right away. And then it's just easier to clean up that way. But like I said, Aria doesn't actually need one. She is just my example. We are going to do sub-Q fluids on our groomer's dog. She is here for vomiting. She vomited overnight. She has a history of eating things. So Dr. Benson wants to do some sub-Q fluids. So how you do sub-Q fluids is your doctor will tell you how much the pet needs. So Guess is a 43 standard poodle, 43 pound standard poodle. So she's gonna get somewhere between 500 and 700 mLs. That range depends on how Guess's skin takes it. So when you do sub-Q fluids, you could either do the sodium chloride or you could do LRS. Typically we do LRS for the electrolytes. So you hang the bag like normal. It's an 18 gauge needle. You tent the skin roughly right above the shoulder blades, if not right at the shoulder blades. Tent it like you're going to give an injection. Insert the needle and just kind of hold it there, and then you open up your fluid line and the fluids start. As the fluids are going, you want to make sure that the fluid bubble that the fluids are creating isn't tight. So you constantly just kind of want to move that bubble around, kind of pick up the skin around it, make sure it's not tight. Once it gets tight, then you don't want to give any more fluids because you don't want them because they can't fit anymore under their skin. So typically you give sub-Q fluids for dehydration. Guess is a little dehydrated this morning, so we're gonna start with her fluids, and 500 to 700 mLs is probably gonna take a good chunk of time to give her, because we're not bolusing her fluids, so we're not squeezing the bag to make them go faster or anything like that. So let's go give Guess her fluids. This is Guess. She's getting her sub-Q fluids, 500 to 700 mLs. So to do that, we have our needle. We're gonna tint her skin like she's getting an injection, and she's kind of fluffy, so I just like to part all the way down to C. Good girl, Guess. Okay, we are in. Open up our fluid line. Good girl, baby. Guess used to be a show poodle, and her mom used to groom her all the time, so she's just a really good dog. All right, we're gonna let this flow for a little bit, and then once she gets to that 500 to 700 mLs, we'll take it out and we'll hold that spot off just a little bit, and then she'll be ready to go. This is my video to demonstrate a bandage. This is my dog Zoe. She's gonna be my also cooperative example. So to do a bandage, we're gonna do her front leg. So we're gonna pretend like she has a break, you know, in her carpus. So we have our stirrup. So you take 2 pieces of tape and a tongue depressor, and you put it one side of tape on each side. So then we wanna go to the side like this. And then we'll take this and go to the other side. And to keep these from getting tangled up, we're just gonna stick the very ends to the tongue depressor. So we'll come back to those later. So we're gonna be straight. So we take our cast padding and you just start wrapping. You don't wanna wrap too tight, but tight enough for it to be snug. And then just gently overlapping it as you go. And you want to make sure that you don't crinkle it in any way, or you know, there's no kind of like folds in it. So just straighten that out real quick. Good girl, Zoe. Okay, come back down. Just gently overlapping. And when you do these, you want to go like 5 layers is the general rule. So this would be 2 all the way down to her toes. Start back up. 3. Still pulling kind of tight. Overlapping just a little bit. Come back down. 4. Down to her toe. Go back up. And this would be 5. About perfect though. And then depending on where the injury is, sometimes you have to go all the way up to their elbow, depending on where their splint is going to sit. So now we'll do the compression gauze, which is, we don't have to do as many layers as this, but this one you want to pull taut, but not super tight. So taut and over, taut and over. Not super tight. And even with the compression gauze, you're still slightly overlapping as you wrap. Good Good job, Zoe. Go all the way up to the top. Come back down. Still pulling taut and overlapping. Good job, Zoe. Since there's just a little bit left, just gonna go back up here. Okay, so now we'll do first splint, and when you do a splint, you want their foot to sit, so the top of the bandage should be flush with the top of the splint. Oh, before we do that, let's get your toes out, Zoe. So take these stirrups. Good girl, baby. And you want to twist the tape and then stick it to the sides of her bandage. So we're gonna twist and stick, just like that. Good job, Zoe. Okay, now for the splint. Okay, so we're in for foot fits. Wonderful, wonderful. So we're back to our compression gauze. So we can start that from the bottom again. And the same thing as we did the first time, we're just gonna pull tight enough to hold it in place without, oops, without pulling too tight where we cause any cut off of circulation or damage. And you're still overlapping and pulling taut. Good job, Zoe. Pulling taut and overlapping. There. Taut, and now I'll go back down. Good job, Zoe. And down to your toes a little bit. Now that that layer's done, and then I already unrolled and re-rolled my vet wrap. So same thing with the vet wrap. We're just gonna start at the bottom and we're gonna pull so it kind of stretches, but it doesn't cut off any circulation. So tight. And we're just gonna overlap as we go up. Good girl, Zoe. And again, you don't want any folds. So now we'll go back down. Okay, tab this so the next person can take it off. Okay, and then we'll take some elasticon And this is kind of just like a tougher kind of tape that we use to not only put on the bottom of like foot bandages and bandages with splints, but we also put it up at the top of the bandage so it doesn't go anywhere. It kind of just helps everything stay in place. So we'll stretch this out a little bit and put it down at the bottom of the bandage all the way. There we go. And then we'll put it at the top, kind of half on top, half on the bandage. And all the way around like that. And then her toes are still out because we did the stirrups. And they're still warm and they're not cold. So depending on the wound, depends on when the doctor wants the bandage changed. Sometimes it's every day for a while, and then sometimes it's once a week, twice a week, so it just kind of depends. But that is how you do a front end bandage with a splint. This is the removal part of the bandage and the splint. So to start, we're gonna take off our elasticon that was holding our bandage in place. So we're gonna unwrap our vet wrap. Good job, Zoe. So then our first compression gauze, unwrap that to get our splint off. Good girl, Zoe. It was just me, baby. Take the splint off. Okay, so then now that we're down to the cast padding, we can just cut all the way through with our bandage scissors. We want to make sure we're all the way down. And we're going to start at the bottom. And we're just going to go up. And then sometimes if they're small kids, kind of like Zoe is, and we can't get through the whole bandage all the way up, then we'll just do it in layers. So right around her corpus is a little tight. So she would be a layer one. And of course, bandage scissors have that protector on it. So all the way up, good girl, Zoe. Good girl, Libby. All the way up. So we'll just gently peel that back. You're okay. We'll take our stirrups, peel those off. I know, baby, I know it's tape. I'm sorry, I'm sorry, I'm sorry. Oh. All right, I'm sorry, I'm sorry, I'm sorry. We're done, we're done, we're done. I'm sorry, I know that tape hurts, I'm sorry. And that is how you remove the bandage. If Zoe got x-rays redone and she wasn't healed, or if whatever she had going on wasn't healed yet, then we would rewrap the bandage with or without the splint, depending on what the doctor wanted after she did her exam. So that is how you remove a bandage with a splint. This is demonstrating an emergency pressure bandage. So this is Zoe, my beagle. We're going to pretend that she has a laceration on her leg that needs to be clip cleaned and then bandaged to stop her bleeding. So we're going to put gloves on because she has a laceration. And sometimes if it's bad enough, so sit. Thank you, good girl. Sometimes if it's bad enough, they need pain control on board. So sometimes we'll give IV pain meds or we'll block just so it's not as painful for them when we clip and clean. So I have my Chlorhex gauze that I will clean the wound with. So we'll clip it out real good, clean it, and then we'll bandage it up. That's a very good girl. You're okay. You're okay. Let me see, baby. Good. You're okay. You're okay. That's it. That's it. That's it. We're done. Good girl. Good job. Okay, clear all that hair away. Clean out your wound, sis. Good girl, Zoe. Clean, clean, clean. Cleaning out the wound. Okay, you sit. You're gonna fall off the table. Sit. You're okay. Sit. Good girl. Okay, so we have our Teflon. So we're gonna put that on first around. And we have our cast padding. And again, just like with any other bandage, you'll start it, and then you'll just gently overlap it. And you want it tight, but not too tight, because you don't want to cut off any circulation. So we'll go up. Good girl, Zoe. And back down and around. Gently overlapping. Alright, good girl, Zoe. Okay, and then we'll take our compression gauze and same thing. Pull tight, come around, but not too tight. Overlapping just a little bit. Good girl, Zoe. Overlapping just a little bit. Pull tight. Overlapping, come back down. Pull. You're okay. You're okay. Hang on, Zoe. Almost done, baby. You're okay. You're gonna fall off the table, Zoe. Hang on, baby. Good girl. Good job. Okay, pull that tight, not too tight. Last but not least, our vet wrap. So vet wrap is stretchy, so same thing. We're just gonna start at the bottom, work our way up, work our way down. You're okay. And so we're tight, but not too tight. Slightly overlapping. Tight, but not too tight. Slightly overlapping. Good girl, Zoe. You're okay. You're okay. Almost done. You're okay, so we gotta go back down, baby. Tight, but not too tight. Overlapping. Okay. Tear this off. Good job. Then we'll just take some regular tape and tape the top, so kind of halfway on her hair and then halfway on the bandage on both top and bottom to keep the bandage in place. Good job, Zoe. All right, and that is how you do an emergency pressure bandage. Okay, so we're gonna do full mouth x-rays on our cat, Davy. Davy's had quite a few extractions in the past, so he's missing quite a few teeth, but we're still gonna do full mouth x-rays to make sure that A, all of the roots are gone, and B, we don't see any new stuff in the teeth he still has. So I have my PPE, and let's do some x-rays. Okay, so this is Davy. We are going to start up on his upper right side, which is the 100s. So Davy is actually missing quite a few teeth. So he is missing his first molar, his fourth premolar, and then 104, his canine. But like I said, we're still going to x-ray everything. All right, Davy Dave. that plate's all the way back. You want to bounce this off just like that. Make sure we're all the way back so we can make sure that 109 first molar is gone. So, and that 108 is missing too. So both of those roots are gone. So we will move on up to, this would be his 106, which is the second premolar. And again, he's lost his canine, but we'll try to make sure that canine root is all the way gone as well. Right. Okay, so there's that 106. We got the root. Wonderful. Double check on this canine tooth. Okay, and all of that root monitoring. Okay, and all of that is gone. So wonderful, wonderful. So now we'll start on his 400s, which is the bottoms. And out of the 400s, the only one he's missing is 409, that first molar. And then on 407, he had a crown amputation. So there's still root in there. His crown is just gone. But again, we'll make sure that those roots are actually gone. And then with the bottom jaw, you can actually, there's like a little, you have a little bit more room to work with, because there's like a pocket in their jaw down here that you can kind of put your plate into. And if you need, if it won't stay where you want it, you can also use some gauze as well. So we're gonna put that there. We'll put a little bit of gauze behind him. Kind of move his head up a little bit. Monitor him real quick here. And the thing you want to remember with x-rays is you want to always position it so you're bouncing off of the plate. So with cats, since their mouth is a little smaller, you might get some of that lower canine, that 404 in there. Okay. Okay, great. So there is no roots for that 409. We got the crown and the root of 408. 407 does not show any roots on x-ray, so we actually got a pretty decent picture of the 404, but we're missing just the tip of it, so we'll go down just a little bit more to try to get the rest of that root. Okay. I'm gonna move this just a smidge. Come at it this way. Try to get that canine root one more time. 404. All right. Got the root on that one. Move along, baby. Okay, so we are going to move on to his incisors. Based on his previous dental charts, he has all of his top incisors. So he has everything from the his third incisors, so 103, 102, 101, and then 201, 202, 203. So we'll get him unhooked real quick, flipped, and then back again. Okay, moving on to incisors. So 103, 102, 101, 201, 202, 203. So we're gonna put our plate like this. How about this? Good boy. Okay. All right, and then we're gonna angle our good job, Bubba. We're not gonna go parallel. We're gonna angle just a little bit. Okay. So these are gonna be all of his incisors on the top. Before I forget, gotta put the needle in on the right side so we know right from left. So we're just gonna weave this in just like that. Needle goes on the right side. Okay. So again, all of his incisors. So 103 to 203.
No wonder. I'm like, wow, I'm not even on the high power yet, and it's really close to my eyeballs. That's what I was looking at.
Is it? Okay, move that up just a little bit. I was a little too flat. Okay, try those again. Incisors 103 to 203. Okay. 101, 102. So I cut off 203. So I gotta move my plate over just a little bit. Put a little piece of gauze in there because he's missing that other canine. That 104. All right, Bubba, good job. It's done. There we go. Okay, so while he's here, we're just gonna push our plate back just a little bit. And we're gonna angle just not so much at his nose this time, but a little more up like this, so we can get both of those canines again. So 104 and 204. And of course, he is missing the 104, so we got the 204 canine. Wonderful. Okay, so we'll get him unhooked again real quick and get him flipped so we can do the left side. Okay, do the left side. So we're gonna start at the top and the back, just like we did on the right side, and go from there. So we are going, so again, on this side, Davy is missing 209 and 208. Little readjustment here with our monitoring. Okay, that was Stephanie. So Davy is missing 209 and 208. So he still has, which are 209 is a molar, 208 is the fourth premolar. So he still has 207, which is a third premolar, 206, which is the first premolar, or the second premolar, I'm sorry, and then 204, which is his canine. So again, we're still going to make sure that even though he's missing the first molar and the fourth premolar, that all of that still looks okay. So we're gonna pop this on back there. Like that. Okay, and we're gonna come.
Some of them.
This way. over there. Bingo bango. Okay.
People's getting close and tempted to like message people and then see, you have every turn to the
I'm gonna move this just a smidge. Okay, wonderful. Crown and the root for both of those, wonderful. Okay, so we'll get this canine tooth again, 204.
Yeah, it's kind of hurry. This is my break. That's 10 minutes.
Okay, wonderful. Got the root on that one.
Because I took it back
Okay,
here.
moving on to the threes. Moving on to the threes. Okay, so for the 300s, Davey has all of his teeth. So he has 309, the first molar way in the back. He has the fourth premolar, 308, the third premolar, 307, and then he has 304. So we can get a good picture of all of these. Okay, so we're all the way back. Bingo bango. Adjust his head a little bit. Ooh. Take his head up just a little bit so we can get under. Okay, so we got all of the molar and the premolars. So then we'll just we'll leave our plate and we'll move our head up a little bit and we'll angle it back a little bit to get the root of that 304. Okay, so 304. Okay, so we got 304. Wonderful, wonderful. That canine tooth. And then Davey also has all of his incisors on the bottom. So he has, so this would be 404. So he has 403, 402, 401. And then the same on the other side as well. So we'll just leave him in lateral for this. We'll put our plate here and kind of prop his head up this way so we can we gotta flip this plate because the right side goes this way. And I'll use his tongue for some leverage. You know what? We'll go with this.
Where's everybody going? Oh, it's a weekend, I'm probably going. Yeah.
Okay, and we'll put just a little bit of gauze here to hold this plate in place. And then we'll come from way underneath and a little bit back to get those incisors. Okay, so we got them. So now I will let my doctor know, and she'll come over and take a look, and then we will scale, make sure it's all nice and clean for her, and then she'll, based on the x-rays, she'll pull any teeth that she needs to, and we'll polish and we'll get him woke up. Okay, so these are Davy's dental x-rays. I had to retake a few of them because my doctor wasn't happy with what they showed. So not a big deal, but these are the final products. Our dental program, we have to upload the pictures into our other program. So that's why we put them all in a Word document. And then from the Word document is how we upload them into their chart. Okay, so this is Claire. She is under for dental. So this is our hand scaler. Both of these ends are subgingival, so it just kind of depends on what tooth you're working on and which way you need to go to pull that tartar out from under the gum. So to do that, for an example, so her first molar here. So to do that, hand scale, you go, she doesn't have much of a pocket, so up, under, and just pull towards the crown. And you don't want to point like this, it's more so the side. So up, down, up, down, up, down. And try to get as much as that tartar that we can up under her gum. Flip it over to the other side. Oh, that one's not gonna work. Go back, go back. And just up. Okay. So this is our ultrasonic cleaner. So basically it does all the work of getting the tartar off the tooth for you. So when you step on the pedal, it sprays water and it kind of vibrates super, super, super fast. So with contact, you only want to stay on one tooth for about 10 seconds because you could actually do damage to it if you are on that same tooth for longer than 10 seconds. And you also, when you do it, it's not so much of like this on the tooth, it's more so on the side because the side is what is going to scrape all that tartar off as it vibrates. And then again, modified pen grip. And you want, when you do the ultrasonic scaling, you kind of want to go in like an X pattern all the way down the tooth to make sure that you get all that tartar off. So just light pressure. Okay, that was about 10 seconds. So I'll go back over to my molar here. And again, I want to stay away from that little crevice. So. And this is, our tip is subgingival too, so you can actually put our tip up there too and get all that off. 10 seconds, so we'll go over here. that off. Remember, I want to stay away from that crevice, so that was about 10 seconds. Get all that off. Go back and work on this tooth a little bit. So then again, with the ultrasonic cleaner, you just tooth by tooth, 10 seconds at a time, and just kind of work your way back and forth until all the tartar is off your tooth. So then again, with this molder, I will go back with the hand scaler and work on that a little bit more so I don't damage the tooth with the ultrasonic cleaner. Polish. When you polish, you just take a little bit of Pro-Free paste, and when you contact the tooth, you still want to go up under the gingiva just a little bit, kind of like in circular motions, and you want to put just enough pressure that the tip of the polisher flares out a little bit, because that's what's going to throw that Pro-Free paste around. And the reason why you do this is to smooth out all of the micro scratches that we put in the tooth, scaling the tooth. So we'll just get a little bit of Pro-Free paste. Wait. You want to get the ends of the teeth up under the gum line a little bit. Stuck on my table. Whoop, losing it. And then as you go through your dental, so on the top half, for example, you do all this side of the teeth, and then you would go to the underside and get all the inside, and then vice versa when you flipped her. So now that we have polished our teeth, we're gonna take our water and we're gonna rinse as I push water through my glasses. Almost kind of like power washing off the Pro-Free paste. Good job, Fleur. Okay, and that side is polished. This is just wear and tear on her tooth from chewing on things. And then a good double check to make sure you got all the tartar off of the teeth is you could always dry the teeth really well. Because if you dry the teeth completely and there's like little white chunks on it, then that's still some tartar that you would have to scale off. But Fleur looks pretty good on this side, so we'll finish up her dental and she'll wake up and go home. Okay, so you wanted to know some options for like dental care?
Yes, I do.
Okay, awesome. So first and foremost, brushing is going to be the best. Some dogs tolerate it, some dogs don't. You can either brush with the toothbrush with or without toothpaste. Some dogs like the toothpaste, some don't. But you want to make sure you have the right size toothbrush for your dog, and you want to make sure that it's dog safe toothpaste. So we have both of those here if you're interested. Other things you can do is watch the big chew on. So for bones and toys and stuff like that, you don't want anything harder than you can't put an indent into with your fingernail, because that can actually crack and damage the teeth if it's any harder than that. Hard food is really good to keep down dental tartar because, you know, the crunchies keep it off. You can buy dental treats that are really, really crunchy. Those are actually the treats that we use here at the clinic, is the square crunchy treats. So those are the dental treats. You can also do like greenies and stuff like that that they can chew on to get that tartar off. Like I said, the soft toys with like nubs on them. Do you know what I'm talking about? If they have like nubs and stuff, that's really good for getting tartar off too. So those are our options.
Okay.